when you see hundreds of patients a year with this problem that have seen multiple practitioners doing some of these things that are not effective, it's frustrating to the doctor, it's frustrating to the patient, and someone needs to speak up. And that's just an example. There are many examples. Another one is dry needling into the muscles as a treatment for neck and shoulder pain. Well, if that neck and shoulder pain is coming from inflammation within the temporal joint, I can tell you that it's not going to be effective. There is a theory behind dry needling. It's done primarily by physical therapists, and that is you put a dry needle into a muscle and it stimulates the muscle to relax. And it may do. It is a theory, but it may do that. But when you take the needles out, and eventually, if that muscle does relax for a while, and the muscle is actually tight, pulling on the bone and creating some pain, it does not relieve inflammation in the joint. So after a relatively short period of time, and this is what I've been told by patients time and time again, is that it works for a short period of time, a few days, and then the pain returns. Why does the pain return? Because dry needling has nothing to do with releasing or decreasing inflammation within the temporal joint. All these things are really obvious. So we need to actually take a look at all of these other treatments. I had an earlier episode that I entitled Poking the Bear, and the establishment is the bear, whether it's the medical establishment, dental establishment, the oral and maxillofacial surgery establishment. All these establishments are very biased as to their point of view, and everyone's welcome to their point of view. However, if you're going to have a point of view, you need to back it up with faction, not fiction, and you need to be able to bring the facts into the open that can be reproduced multiple times by multiple providers. That makes it fact, not fiction.